Welcome to the IAPB webinar on advancing access to vision-related assistive technology. My name is Zoe Gray and I am the Advocacy Manager at IAPB. I will be chairing this webinar today. We are expecting a full house, which is fantastic. If you would like to introduce yourself to the group today, you can write your name and which country you are from in the chat box on the side panel. It would be great if you can also state what kind of organization you are from, such as NGO, government, or service provider. A huge thank you to our webinar presenters today, Emma Tebbett from WHO's Global Cooperation on Assistive Technology, or GATE, Kylie Mines from Motivation Australia, Margaret Savage from Clinton Health Access Initiative. Over 90% of people that need low vision services do not get access to them. 1 billion people don't have access to the glasses that they need. Access to assistive devices and rehabilitation services have not tended to be prioritized in universal health coverage or in reaching the Sustainable Development Goals. They do not tend to be prioritized at the national or the local level. A number of really exciting key initiatives aimed at changing the landscape of access to vision-related assistive technology and other assistive technologies are currently underway to address that. The presenters today from WHO GATE, Motivation Australia and Clinton Health Access Initiative will speak about these initiatives related to vision, and they will also use examples from other areas of functioning. The webinar will take in piloting new approaches as a means to increase coverage and influence countries to improve systems and to improve access. It will cover how members and others may connect in with the different actions and help shape them. It will cover accounting for market and health system barriers to coverage and accounting for quality control. The presenters are really interested to hear from people what the main barriers to accessing low vision assistive technology are in their settings and what more they can be doing to overcome these barriers. It is intended that the discussion will incorporate an advocacy focus. It should include consideration of how we can work to raise attention to vision-related assistive technology and other technologies, how we can work to promote integration within universal health coverage and within schools. And finally, how we can ensure greater commitments and greater action from national governments to tackle the massive unmet need. So firstly, we have Emma Tebbett from WHO GATE presenting. Emma has been a technical officer at the World Health Organization since 2015, working on the Global Cooperation on Assistive Technology, GATE. She is coordinating the development of WHO tools aimed at supporting countries to improve access to assistive technology. These include the training package that Emma and Kylie will talk about today, as well as guidance on integrating assistive technology service provision into the health system, amongst others. Emma is a British physiotherapist by training and previously worked for an Indian NGO who focus on addressing gaps in the rehabilitation and assistive technology workforce, especially at the community level and in rural areas. Emma is particularly interested in task shifting or task sharing as a solution to workforce challenges, and because not all tasks need a specialist. Emma, please go ahead with your presentation. Thank you.
Thanks, Zoe, and hi everybody. It's great to be here today, and thanks to Zoe and the IAPB team for organising this webinar. So I'm going to start by giving a brief overview about assistive technology. I know some of our listeners are already quite familiar with the topic, but I think there are quite a number of people who perhaps aren't so familiar. And I'll talk a bit about WHO's work on assistive technology before handing over to Kylie. Next slide. I'll carry on. Great. So a few assistive technology facts to set the scene. So WHO talks about assistive products, also called by lots of people assistive devices, assistive aids, assistive technologies. But these, I think we all know what we're talking about. They're external products whose primary purpose is to maintain or improve an individual's functioning and independence, and thereby promote their well-being. So examples include wheelchairs, eyeglasses, hearing aids, communication boards, pill organisers, to name a few. WHO refers to assistive technology as both the products and the related services, so the whole ecosystem involved. And another key thing to mention is that WHO is that access to AT is a fundamental human right, as mandated through the UN Convention on the Rights of Persons with Disabilities, which has now been ratified by 177 countries. 1 billion people need AT, as Zoe said, and despite the CRPD having been in place for over 10 years, still only 1 in 10 people have access today. And so WHO established the GATE initiative to address this gap, and in direct response to Article 32 of the Convention, which also calls for international cooperation. And so what does AT do? Why is it so important? We talk about it as an enabler and the first step for any next step. This slide shows 5 people in different countries around the world who are all using an assistive product in order to access education, work, get out into their communities, or to stay independent. And this is also why the Global Cooperation on Assistive Technology is abbreviated to GATE, because AT can open the gate to inclusion and participation. I think we're all familiar with the Sustainable Development Goals and collectively working towards them. This slide shows WHO's representation of the SDGs, which places Goal 3 at the centre, good health and well-being. And if you're a person who needs AT, you need AT in order to have good health and well-being. And so I think we can also say that AT is at the centre of the SDGs, and we can't achieve the goals without everyone having access. Target 3.8 of Goal 3 is universal health coverage, which Zoe mentioned. For people who aren't familiar with universal health coverage, it's one of WHO's top 5 priorities. And universal health coverage, or UHC, means that all people and communities can use the health services they need of sufficient quality to be effective, but while also ensuring that the use of these services does not expose the user to financial hardship. So a fundamental component of a quality, effective health service is the availability of essential medicines and health products. So hang on a minute, I've been talking about assistive products and now I'm talking about health products. Yes, so for a long time, ministries of health, WHO, global health communities have been focusing only on medicines and vaccines and ignoring the other health products which are essential for comprehensive quality health services. And by health products, I mean medical devices, diagnostics, other health technologies, including assistive products, which are all needed in order for the health workforce to do their jobs effectively. And there's no coincidence, therefore, that WHO's work on assistive technology sits within the division of medicines and health products. And this is in order for WHO to directly support countries to improve access to all health products within their universal health coverage schemes. But I should also mention that while the GATE team sits within the division of medicines and health products, we also work closely with disability and rehab teams and the teams working on vision, hearing and ageing particularly. So I'm just going to give a bit of detail about WHO's work on AT specifically. The first key milestone in 2016 was the publication of the first WHO list of priority assistive products. And this list is based on the principles of the WHO model list of essential medicines. So by model list, it's a list for countries to use to guide the development of national lists based on the resources available and the local context. The priority assisted products list includes devices for vision, hearing, mobility, communication, cognition and self-care. And I think there are over 10 products that could support a person with vision impairment with their functioning. And WHO is not alone in its global efforts to improve access to AT. There are many organisations and groups working on this, too many to be named, and many of you who are listening. But another great milestone for AT in 2018 was the launch of AT Scale and AT 2030 at the Global Disability Summit. And this slide shows a photo of the Global Disability Summit and the two logos. AT 2030 is a UK aid-funded programme which brings diverse partners together to improve access, and WHO is working on a number of initiatives within that programme with other partners. WHO is also a forming committee member of AT Scale, the Global Partnership for Assistive Technology, and Maggie will talk a little bit more about both of these initiatives in a while. And the third milestone that I want to talk about today is the World Health Assembly resolution on AT, also in 2018. This is the first ever resolution specifically on AT, adopted by all WHO's 195 member states. This slide shows a picture of the Assembly in action and a screenshot of the resolution document. But what does a resolution actually mean in reality? So it means for the first time that AT is on the agenda of the Ministry of Health, and just the process of this getting this resolution through the Assembly served to raise awareness and really improve understanding about this topic, which has been neglected for so long. And through the resolution, countries have signed up to developing national priority assisted products lists to include AT within universal coverage schemes, to ensure the availability of trained workforce, to collaborate internationally and regionally on procurement, to collect population-based data, and quite a number of other things. The resolution also requests WHO to provide technical support to countries and to publish a global status report on AT by 2021. And WHO recently held the first consultation for this report in Geneva, and there's not probably time to go into that today, but more information on the website. WHO is governed by its 195 member states, and it's the organisation's primary function is to support those member states. And so GATE is working to develop tools to do that. And I can talk about those on the next slide. So we talk about the 5P, and GATE's work is framed around 5P. This slide shows a diagram of the 5P. And the first P is people, who are placed at the centre of the other P. And the other 4P are policy, products, personnel, and provision. And these 5P are essential for any AT ecosystem. So first, in relation to policy, GATE is developing tools to assess population need for AT and the capacity and systems to provide it. And we're working with London School of Medicine and CHAI, as well as other partners on these. Products, we already have the priority assisted products list, and we're now working on a procurement guide and technical specifications to support the implementation of national lists. In relation to provision, promoting and piloting an integrated model of service provision, which I'll talk a little bit more on in the next slide. And lastly, personnel or workforce, and that we're specifically working on the training package, which Kylie will talk about. And I also at this point like to acknowledge US aid and UK aid, who have been supporting WHO's work on all of these activities, and without them we wouldn't be where we are today. And so integrated AT service provision. Hopefully the slide's coming. One of the current challenges in access is the lack of ownership and the fragmentation from the ministry level right down to the service providers. And most of us need assistive products for multiple areas of our functioning, and currently, through existing systems, we're pushed to different places and different appointments for access, which is not very person-centred, but also not cost-effective. This diagram shows the triangle of the health system from a primary to a tertiary level, with a wedge in it from the bottom to the top, showing that AT services should be integrated into health services across all levels and not as standalone isolated services. And this is similar to the model in Norway and several other countries around the world, but we're now working on piloting this concept in a number of low middle income countries, which we hope we can then countries can then learn from as they go on to improve their systems. So I'll hand back to Zoe to introduce Kylie to give some more detail on personnel and the training package.
Brilliant, thank you very much, Emma. Just to introduce Kylie, Kylie Mines is an occupational therapist. She joined the Motivation Charitable Trust in 1993 to establish a national wheelchair service network in Cambodia. This led to living and working in a number of countries in Asia and Southeast Europe, with a focus on building the workforce capacity and service systems in those countries to provide appropriate mobility devices. Today, Kylie is founder and CEO of Motivation Australia, an organisation working in partnership with government and NGOs in Pacific Island countries to increase access to inclusive health, rehabilitation and assistive technology. As a consultant for the WHO, Kylie contributed to the development of the WHO guidelines on the provision of manual wheelchairs in less resource settings. She is co-editor of the WHO Wheelchair Service Training Package, and she is currently working with Emma from WHO on the development of TAP, training in assistive products. Kylie, please begin your presentation. Thank you very much.
Thank you very much, Zoe, and thank you, Emma, for a fantastic lead into the TAP project. And it really is a great pleasure to be here to talk with all of you tonight. Tonight, I say, because I'm in Australia and it is evening for us here. Can I just have the next slide up, please? So, as said, what I'd like to do is just introduce you a little bit to training in priority assistive products, so TAP. This is a project which is still under development, but I'm fairly sure that some of you that are in the room are already aware of it, and I'm sure there are some of you in the room that have been involved as contributors or reviewers. And to reiterate what Zoe said earlier is we are really keen to have maximum involvement from as many stakeholders as we can as we work together collaboratively to develop this package. Because we really want to encourage you tonight to post your questions and potentially get in contact with us afterwards as well if there's something that you really want to share. Because really there's so many strengths that are out there and many people are already doing so much in this area, and we really want to be able to bring that learning into products such as this. If we could go to the next slide, please. So just a quick recap of the issues that we're facing when it comes to the healthcare workforce, thinking about being able to make assistive technology more accessible. So the problem is that we have a shortage of healthcare workers overall, and that is estimated to be around 18 million less than we need to have in order to be able to meet the healthcare needs of the global population. Furthermore, there's an unbalanced mix of skills and also the geographical distribution of those healthcare workers. So I'm sure it's no surprise to many of you that most specialist staff are usually in urban centres, so people that are living in more remote locations find it much harder to access specialist services of any type. And there just simply aren't enough of the more highly trained personnel to be able to provide services such as assistive products. And training of higher educated staff in training curriculum around assistive technology is largely absent from tertiary training. So there's not enough of our higher qualified staff, and they tend not to have training in assistive technology anyway. So WHO's response is to think about how we can support countries to build the capacity of their health workforce to be able to provide basic assistive products at the primary healthcare level, and through developing the open access online training package, which is TAP. If we could go to the next slide, please. So the intent behind TAP is essentially to increase access to assistive products at the primary healthcare level. There are two really key objectives. We're targeting primary healthcare personnel to provide them with the knowledge and the skills that they need to be able to provide the basic assistive products that are identified in the APL, but looking at those, so the assistive product list, but looking at 25 of the 50 that are considered to be those that will be least complex and more readily able to be provided at a primary healthcare level. So that first objective of TAP is to really look at building the competencies and the skills of a primary healthcare workforce to provide assistive products. The other objective is to broaden awareness of assistive product provision as a whole and to equip the broader workforce to be able to recognise who may need referral into AT services. So we've really got this sort of two-tier approach. Just to explain the slide that's in front of you, we have two pictures there, and they show pilots that have happened for the TAP project so far. So the one towards the top was taken in Bangalore. There's a group of health workers looking at a walking aid, and then just below that you can see a group of people involved in a vision screening in Papua New Guinea. If we could have the next slide, please. So one of the really key elements about TAP is how we can, in a way, demystify the provision of assistive products and really break down the complexity that can sometimes be we can sometimes get caught up in when we're providing assistive products, but at the same time making sure that the practice remains safe for everybody involved and that the results are effective, and so that people receive a product that suits them, meets their needs, it's fitted and adjusted for them, they know how to use it, and that we put follow-up into the cycle. So what you're looking at now is a slide which just shows a graphic that has been developed for TAP, which symbolises the provision of assistive technology through a simple four-step process. And it's graphically represented in a way that it shows a cycle, because we know that when people receive a product, they may well need to come back again to receive a product again once that, if they're a child and they grow out of it, or if their needs change, that assessment cycle goes around again. So the four steps that we've really used as a framework when we're teaching the provision of the 25 basic assistive products through TAP includes step one, which is select, finding the most appropriate product for the person's needs. Step two is fitting it, so adjusting and fitting it for their needs. Step three is using it, teaching the person how to use and take care of the product, and then follow up. Step four, so covering off on reviewing the person's needs, maintaining and repairing the device. So we're using 4 steps because it's easy to remember, it's easy to teach, it's applicable to most assistive products, and it reinforces that cycle of provision. It's not a single intervention. So the next slide, please. So TAP is structured around a number of different modules, and the point of using a modular approach is to enable it to be similar to a menu, so that a health workforce or someone that's planning the capacity building of their health workforce can choose modules that really suit the needs of what that workforce is going to be doing. There are a number of modules that we very strongly message through the platform, are the ones that you really need to start with. So the graphic that you're looking at the moment shows the overall modular structure, with one introductory module across the top, which is called Introduction to Assistive Products. And then we have 6 streams: cognition, communication, vision, hearing, self-care, and mobility. So for each of those streams, there's an introductory module. And then under each one of those, you come to the product-specific modules. So obviously with Introduction to Assistive Products, we're introducing the concept, the 4-step process, and then when you go to the introduction of each stream or each functional area, we then start to talk about the sorts of people that may need a product, for example, for vision, and then what kind of products there might be. And we'll introduce very simple screening tools to help people start to make identification of who they may be able to assist with the basic assistive products, or who they need to refer for more specialised support. So those early introduction modules are really about equipping the broader workforce who would be looking at screening and identifying and referring into AT services. Those modules are also really useful for raising awareness of assistive technology, and for people that may want, but for users of assistive technology themselves, to be able to get more information about what might be out there that could help them. And then the product-specific modules are where the primary healthcare personnel would be going deeper and understanding what's their role in following those 4 steps to be able to provide assistive products safely. If we could have the next slide, please. So with the design of the platform, as we've said, it's online, it's open access, it's free to use, and our intention is to have a platform that is interactive, it engages the learner, and also is accessible. So we are taking guidance from accessibility experts, and we're also testing the accessibility components of the platform to make sure that those that need accessibility features find that it is usable for them. We have really emphasised using plain English, again thinking about making this as accessible as possible, and to simplify translation in the future. We've really focused on bringing forward the minimum content that is needed to safely pass on the information and the competencies that we'd like to see people having. And that really means, again, demystifying, stripping down the complexity, but at the same time making sure that we are following best practice, because this is about good quality competencies. There are a number of different ways that we try and engage learners through the platform. So thinking about the different illustrations that we use. So, on this slide, you can see in the top of 3 different images, there's an illustration. It's very colourful. Ideally, we're using the illustrations to be very clear and to point out the key learning element behind a piece of information, and to really reinforce that learning. We also use short video clips to provide technical information in a very simple way. So there are some tutorial examples there, which Georgina is going to show just as an example. One which is showing how to fit a walking stick. So these videos deliberately have very minimal text. We focus very much on using, as you can see here, just some simple ways of highlighting the key point that we're trying to make sure people are understanding, that this is the thing that they will need to be practicing, and this is what they need to be looking for. So here we're saying, if you're fitting the walking stick, if someone's standing there, make sure their shoulders are down, their arms are relaxed by their side. This is where the handle of the walking stick should meet in terms of their wrist level. If you can stop the video now, Georgina, thank you. So there are just a number of different ways that we're trying to make the learning as interesting and as engaging as possible. If we could move to the next slide. This now will just give you a couple of screenshots which show what TAP looks like when you go into a module. So on the left-hand side, you can see lots, both left and right-hand side are different parts of the training. These are both taken from one of the vision modules. You can see there's a fair bit of white space, there's not too much text, and we're really, again, pulling out the key points. So on the left, that's a section which is talking about, which is really just a text piece of information, which is providing content. And then on the right-hand side, you can see we have a story of a young boy who uses a white cane, and then underneath there are questions to get people to engage with that story. We can move to the next screen, please. So I'm just going to now give you a little bit of an overview on where we're at in terms of progress on the vision modules, which I think will be of most interest to those of you in the room. So you'll see again the graphic which shows the vision introduction, and that module really just introduces the basic concepts about the problems that people may have with vision. We then introduce some of the different vision assistive technology. We emphasize those products that are covered in TAP further down in those product specific modules, but we also introduce people to other vision ATs so that they get the whole picture. So for example, with TAP, we are not talking about prescription glasses. However, we do identify them as an assistive technology that people with different vision problems would use. And then we introduce how to carry out a very simple vision screen, which is designed to help people work out where they can provide assistive technology safely, where there may be a health problem that they really need to stop and refer to a doctor or an eye health professional, and also where there are assistive products that someone may need that they are not really going to be learning how to use through TAP. And then we have the reading glasses module, which explains in the simple 4-step process how to provide reading glasses. And then the magnifying glasses and telescopes module, which introduces a simple range of basic magnifying glasses and monotelescopes, and again uses that 4-step process of provision. With this module, we emphasize very heavily that magnifying glasses and telescopes really should be provided after there has been a full eye health professional assessment. And where we're at with the development of the modules is that the vision module has been piloted twice, as has the reading glasses, and the magnifying glasses and telescopes module has been piloted once. With the vision and the reading glasses module, we were able to pilot the learning that people gained from going through the modules, and then also how that played out in practice. With the magnifying glasses and the telescopes, we've had feedback from learners who've gone through, but we've not gone to that step of actually saying, okay, how does this translate into their practice and their competencies? And that's something I'll explain just towards the end of my presentation. So very briefly, to give you to the next slide, sorry, Georgina, thanks. Just to give you a very brief overview of the 2 pilots that we have carried out, one in Bangalore in 2018, which this slide speaks to, where we visited Bangalore and we worked with local organisations there. 24 participants took the modules, and that was observed by the evaluation team, so we could really see how people were interacting with them. And then we evaluated through observing role play and supervised practice, focus groups, participant surveys, and looking at the results of pre and post quizzes to see how much learning people were gaining and how quickly they were able to translate that into practical competencies. It was a very useful pilot for us. It gave us a lot of information about the content level of TAP at that stage and how close we were to achieving that goal of stripping down the content to give the right level of competencies. And the key thing that we really identified people struggled with at that point was those steps around clinical reasoning. So gathering assessment information and then working out right from that, what does that mean in terms of selection of the right device? And so that led us to do more work on the next iterations of the modules to really provide additional supports into the training around those clinical decision making steps. And then the next slide, please. So for the second pilot, which was much more recent, just a couple of months ago in Papua New Guinea, we took the next step and provided the modules online ahead of the team arriving in order to get a really good sense of how easy it was for our target population to access these modules online, to go through the training as a part of their daily work practice over a period of 2 weeks. The evaluation activities were very similar. We went up to Port Moresby and spent time with all of the stakeholders to go through those activities. And I think a very key finding for us all with that was really recognising those challenges that primary health workers, community health workers really face when it comes to securing what we would call an enabling environment for learning. So time in their day, the space that they need, the tools, the equipment, the access to the internet. So these are all challenges that I think everyone is probably very familiar with, and certainly something that we need to think about when it comes to the rollout of TAP. And so a part of that is really communicating very strongly to those using TAP in the future that there needs to be real thought behind how it's rolled out, and building in supervision to really support learners taking knowledge and moving that into practice. So having supervisors in country is an important aspect. TAP really can't just stand alone. All right, I'm going to just finish off with a brief chat further on a very, very quick summary of a story from Papua New Guinea. So if you could just move to the next slide, where there is a picture of a young boy that we met during the pilot who has low vision. He's using prescription lenses that have been, they're on an assessment rig where the lenses and his prescription has really just been identified through really good refraction from a visiting optometrist. He's also using a dome magnifier. So he's combining obviously the correction that's been provided through those prescription lenses with a low vision device. And with the two devices working together, the two assistive technologies, he's able to read quite fine print. And this is really, I think, a dilemma that we would love to pose back to those of you who are listening as a question, is how we can best utilize a tool such as TAP, which is designed to put basic magnifying glasses and other low vision devices into the hands of primary health care workers, recognizing that the refraction that may well be needed by a user of a low vision device can't really be managed at the primary healthcare level and cannot be taught through a system such as TAP. But we need somehow to be able to get these workers together to be able to provide these devices effectively. And that's a question that we are looking forward to working with further and piloting in other countries as we move forward with the TAP project. So thank you very much. I'll hand back.
Thank you very much, Kylie. We are getting some questions in the chat, if people can continue to add them in. We're running a little bit over on time, so I expect we will go past 1 o'clock, probably about 10 or quarter past. I hope that suits at least most people on the line. But please do keep adding your questions. But now I'll introduce everybody to Margaret Savage, and we'll keep what questions we already have until the end. So Margaret Savage is the Programme Manager for Clinton Health Access Initiative, or CHAI, work on assistive technologies, where she leads CHAI's work stream to scope 5 priority assistive devices, including eyeglasses, to develop market building and market shaping strategies to increase availability, affordability and access. She has been with CHAI for 5 years and previously supported CHAI's health financing team in Ethiopia and CHAI's new market opportunities team, which identified new areas to apply market shaping approaches to increase access to health commodities. Prior to CHAI, Margaret worked on pricing and market access strategy for pharmaceutical companies. For those of you on the webinar who are from IAPB member organisations and who are attending next week's Committee of Members meeting in Tanzania, Margaret will be participating in a session on revolutionising access to glasses there. Margaret, please go ahead. Thank you.
Great, thanks so much, Zoe. Thanks everyone, excited to be here and sharing with you all some of the initiatives around increasing access to assistive technologies that have taken off in the past year and the role that CHI is playing within them. I want to acknowledge that the work that CHI has been doing has been delivered under the AT 2030 program, which Emma mentioned and is funded by UK aid. Today, I'll start by speaking about CHI's work more broadly on addressing market barriers to assistive technology, and then go into a little bit on how we apply this within spectacles. Next slide. So to begin, I just want to speak a little bit around the challenges driving unmet need for assistive technologies and how these are diverse and multifaceted, and that we often see that these challenges are present on both the demand and supply side. So on the demand side, we oftentimes understand through the initial work that we've done across different assistive technologies that we have low awareness around the need for and importance of appropriate AT among end users, service providers, policymakers. We know that there's little or no government involvement, which leads to no real public market. This also means that limited financing is available both on the public and private side to enable the purchase or provision of assistive technologies. We also know that to fill funding and product gaps, a range of products have been designed by different organizations and are being delivered through different mechanisms. This often contributes to a market landscape that is fragmented in financing, procurement, products, and service delivery. And then lastly, where we also know that there's that lack of service delivery due to the investment in the sector. So really you're seeing a cycle of issues there on the demand side. This is further created market challenges on the supply side when we know that there's insufficient participation by suppliers of assistive technology in low and middle income countries. We know that there are limited incentives for leading global manufacturers to enter low and middle income markets with those appropriate products. When we do have products available, manufacturing economics are not favorable to be able to supply at lower cost. For example, suppliers are unable to reach scale due to small volumes or erratic ordering patterns. We also know that they're not using cost-effective supply mechanisms. And in many areas, there's an absence of user-centric innovation as well. And then lastly, on the supply side, we oftentimes see this preference for locally manufactured products, which shifts resources and potentially leads to higher cost and lower quality products, depending on the assistive technology that we're discussing. These supply and demand side challenges are further hindered by a weak enabling environment, which includes things like limited political will to prioritize AT, limited quality assurance mechanisms, and limited data on funded demand for AT. So essentially what I'm talking about here is a cycle that really creates some market traps to ensure that products aren't available, affordable, or accessible. Next slide. So given all of these challenges, the global community over the past few years has recognized the need to take coordinated action. Over the past few years, as highlighted by Emma, the broader global community has generated incredible momentum by committing to the multiple different development goals, including UHC by 2030, which was further espoused yesterday at UNGA, the SDGs, the resolution passed by the World Health Assembly in 2018, on access to assistive technologies, and continued support by countries for the Convention on the Rights of Persons with Disabilities. That's a long list of different goals, and we know that none can be achieved without step change in how assistive technology is provided and a clear path forward to unite a traditionally fragmented and under-resourced sector. Therefore, we believe that a multifaceted effort and systemic approach that spans market shaping, capacity development, and policy reform is required. And this will include a broad set of stakeholders across sectors coming together around a coordinated set of activities and resources to achieve an impact greater than the sum of any one organization's contributions. With that in mind, we can go to the next slide. And therefore, two initiatives launched at the Global Disability Summit in July 2018. And Emma highlighted both of these, and I just want to go into them in a little bit more detail for folks. So the first is AT Scale, the Global Partnership for Assistive Technology. And it was really launched to revolutionize access to assistive technology in low and middle income countries. As I just said earlier, AT Scale really grew out of the need to bring together a broad set of stakeholders with an ability to raise political will and inspire action, mobilize resources and encourage public and private investment, and address the market barriers with new approaches and targeted investments. AT's goal is to catalyze action to ensure that 5 million more people globally are reached with life-changing assistive technology by 2030. And its mission is to build that cross-sector partnership that is a catalyst for change amplifies existing work, and coordinates and mobilizes global stakeholders within a unified strategy to increase availability and access to affordable and appropriate AT. AT Scale is currently guided by a forming committee of 11 partners and is in the process of finalizing its governance model. In February 2018, AT Scale released its strategy overview that highlights the initial strategic priorities and near-term objectives. The second initiative that was launched was AT 2030. This is a £20 million investment by UK Aid. AT 2030 was designed to explore and begin to test innovative ways to address systemic challenges we discussed earlier in order to get more AT to the people that need it around the world. It's really thinking about testing what works. With a focus on innovative products, new service models, and global capacity support, the program aims to reach 9 million people directly and 6 million people more indirectly. AT 2030 is a consortium led by the Global Disability Innovation Hub and brings together over 20 partners who may not traditionally work in the AT space with AT users, innovators, and experts to overcome the barriers to access. These partners are working across 4 program clusters that group 11 different sub-programs. And these clusters include improving data and evidence to enable better decision-making and unlock investment into AT, sparking innovation and supporting new products and service delivery models to scale access to AT, implementation to lay the foundations for market shaping and systems level change, and building partnerships, capacity, and community solutions. This includes support and sharing learnings to AT Scale, which I just discussed earlier. Within AT Scale and AT 2030, both recognize the need to drive availability and affordability of AT through market shaping principles. These are the types of market shaping principles that have been used in other areas of global health to increase access, and we'll talk about them a little bit more in a minute. An objective was established by AT Scale to identify those interventions required to shape markets on an initial set of 5 priority products, so wheelchairs, hearing aids, prosthetics, spectacles, and communication devices with accessible software. And so to support this objective, CHI is developing the product narratives under the Drive Availability and Affordability subprogram of AT 2030. These strategic approaches are being laid out in a series of reports called product narratives, which I'll talk about in a little bit more in depth in just a minute. Next slide. With that background, I want to speak a little bit about market shaping and why we talk about market shaping in the context of assistive technology. So we discussed the large unmet need and factors driving unmet need. If we narrow down to market barriers, market shaping is proposed as an approach to improve a market's outcomes by targeting the root causes that limit availability, affordability, and access of appropriate assistive devices and related services. Specifically, market shaping looks to use 3 levers to reduce and overcome market shortcomings. 1, it looks to reduce transaction costs and lower the structural hurdles and inefficiencies that may exist in a market between buyers and suppliers. 2, market shaping looks to increase market information and market transparency and reduce asymmetries of information by generating new data, aligning existing analysis, or improving the visibility of data. And lastly, market shaping may balance supplier and buyer risks or lower risks to operate in a market by transferring those financial risks to donors or other purchasers. The global health community has deployed market shaping approaches across essential health commodities over the past decade and just demonstrated its potential to successfully increase access. This includes things like reducing the cost of antiretroviral drugs for HIV by over 99% in the past couple decades, or doubling the number of women receiving contraceptive implants in 4 years while saving donors and governments over $240 million. I'm going to ask that you skip the next slide to save time. Great. So enhancing market efficiencies requires a coordinated approach between stakeholders involved on both demand and supply side activities. On the demand side, we look to work with governments, DPOs, NGOs, CSOs to build and consolidate demand around optimal products in terms of efficacy, specifications, quality, and price. We may look to strengthen procurement processes and programs to utilize optimal products and improve the financing and service delivery mechanisms that exist. On the supply side, we may look to work with manufacturers and suppliers to achieve efficiencies in production and supply, enhance competition and coordination, encourage adoption of quality standards, optimize product design, and accelerate entry and uptake of new products. Together, this is how we kind of begin to increase access to products. Just quickly, some examples of market shaping interventions that have been used in the past include mechanisms such as pooled procurement or de-risking the market demand through volume guarantees, or potentially increasing visibility by developing demand forecasts and market reports, or looking to standardize specifications across different markets. Next slide. As mentioned earlier, CHI is developing the product narratives to support the identification of interventions required to build and shape markets for products and related services. For each product narrative, a rigorous analysis is being undertaken, informed by desk research, key informant interviews, site visits, to really understand that market landscape and the viability of hypothesized interventions. We know that interventions need to be tailored to the specific markets and rooted in robust understanding of the value chain, market barriers, and opportunities. The outcome of these analyses is being documented in these reports called product narratives. The narrative defines the proposed approach to sustainably increasing access, availability, and affordability to quality assistive technology and related services in low and middle income countries. And the goals of the narrative really are, as laid out here on the bottom of the slide, to provide an overview of the market landscape and the market challenges, identify and propose long-term objectives to create healthy markets through market building and shaping, and then identify those immediate activities in need of investment so that we can reach our long-term outcomes. Next slide. As we develop the product narratives, we really look forward to engaging with the vision sector on the market shaping approaches for spectacles, as well as potentially the other 4 priority product areas. I really would ask that if you're interested in engaging with us through the consultation process that is ongoing right now for spectacles, that you would reach out to Mathilde Chandron at mchadron, which is MCHAUDRON at clintonhealthaccess.org. Mathilde and I will also, as Zoe mentioned, be at IAPB's COM meeting in Dar next month. The process for the product narratives is really that we are in the fact gathering stage and really looking over the next few months to engage with the sector on what some of those market barriers are and what some of those proposed investments or solutions may need to be. It's expected that we'll have a final product narrative to share with the sector by the end of the year or very early next year. In order to ensure that the analysis that we're doing right now on the priority product areas leads to action, the proposed strategic approach from these will be translated into action and investment plans for AT scale. These analyses and these action and investment plans also will help to inform the approach and activities of partners within AT 2030 program and the wider sector. So we look forward to continuing to engage with all of you in the community on the market shaping work for spectacles, and please do reach out if you would like to have a conversation with us. We really look forward to it. Thank you.
Thank you very much, Margaret. We have a number of questions that have come through via the chat boxes, and I have some questions as well. But please do send those in to us now, because we'll aim to wrap up in the next sort of 15 minutes. So if you do want to put a question to any of the panelists, please do share it with us now. So I'm just going to read out a few of those. And then I think then if whoever amongst the panel would like to speak on those, just please advise me. Some of them may be relevant to some of you and some to all of you. So we have a question from Samson Weldegioros. Excuse me, I'm sure I've pronounced that entirely wrong. Thank you very much for the webinar, as it's very relevant to my line of work. My question is for the first speaker: what do we mean by integration to ensure universal health coverage? So if you could just make a note of that, and I'll tell you some of the other questions that have been put forward. Just bear with me a moment. Okay, here we go. It is a great effort to include assistive technology in primary healthcare. I would like to know, when training primary healthcare workers, will they be made aware of some cases which need to be referred, because many eye-related diseases causing low vision may have comorbidities. There's another question, which is, so we have a range of questions, both sort of from macro to micro level. So this is, I guess, more of a general question. Another challenge is also the social stigma in using assistive technology in lower and middle income countries. How do we deal with these to improve demand? Emma, would you like to start with the question around universal health coverage, and then those other speakers, you can step in as you'd like to answer the other questions or contribute on that one.
Yes, thanks, Zoe. I think, thanks, Samson, for your question. I think you're probably referring to our triangle slide. And I think the message that I was trying to really get across is to advocate that for UHC to be inclusive, AT needs to be included within it as a core component and within UHC packages, insurance schemes, and so on. That integration into the health system is a person-centred and we think cost-effective vehicle to do this. I think Kylie can go on and answer, respond to the vision question.
Okay, yes, thank you for the question related to referral and screening and how does that work. And it's something that we were very conscious of and have worked really closely with vision specialists to make sure that people that are seen by a primary healthcare worker with a vision problem get the help that they really need, and that we don't have a situation where someone is provided with reading glasses when actually really they need medical treatment for an eye condition or another condition. And so the simple screening that I mentioned that we've developed starts off with a very simple eye health check, which looks at observing the eye health. There is a question specifically related to whether someone has diabetes or is aware if they have diabetes because of the high risk there, and whether they have pain or discomfort. And that again comes back to making sure that TAP is rolled out in a way that there is supervision as people are getting their skills and their competencies, so that they are able to really recognise those abnormal signs and the different triggers. There's information in TAP, but then it really needs to be reinforced. And then there's a very simple distance and near vision test, which again would pick up issues, and there are flags and very, very strong signals throughout the training about referral. If you're not sure, refer. So really that's where we need to work, is provide the good information, but then also providing that good supervision and training to the workforce so that they are aware of their roles. Yeah, thank you.
There was the other question on primary health, no, rather on, I think it was around stigma and discrimination and issues around use of assistive technology. Would that be something that you might like to cover, Margaret?
Absolutely,
and any others?
Definitely. I think very much so in that in the thinking around what are some of those demand side barriers that social stigma and using AT is very much a part of one of those. And I think that just for space on a slide, we didn't get it in there, but I think it is a really critical piece of that. And it's around that idea of moving beyond and addressing some of those stigma issues, as well as increasing awareness and political will, that all three of those kind of play together to really build that foundation to how you start to really think about market building before you can even move into market shaping as well. So I think thanks for the question, and I think it's definitely something that we've spent a lot of time thinking about and is included in the product narratives as well. Zoe, I noticed that there's one question around what defines a healthy market, and I'm happy to take that one as well.
I see that it's from Johan, who will be editing the global report on assistive technology. Yes, no, please go ahead. That would be great. Thank you.
Absolutely. So thanks for the question, Johan. I think in other areas of work that TRI has done around market shaping, we often do kind of think of what the healthy market would look like. And I think we're still looking to answer that question for assistive technology, because it is such a new area to really look into this. But I think some of the key things that we would really think about in terms of a quote unquote healthy market is that you really have global supply meeting or exceeding global demand, and that the risk of the supply disruptions is low. Really, I think that sits with this idea of how in the space of assistive technology, we've moved to also speaking about market building, because we know that often is not the case, that we may have limited supply, and we also have limited demand. And so there's a real mismatch between those two. I think other things that we would oftentimes think about is that, you know, the purchasers have some informed decisions and can really show preferences, and that you have competition in the market to really help prevent supply disruption, and also then really be able to support maximum value for those products as they enter into the market. So those are just a few things, but I think always welcome to have a longer conversation on markets and what makes a healthy market, particularly for different assistive devices.
Great, thank you.
Zoe,
sure, Emma, go ahead. Yes.
Yeah, I just wanted to add to Maggie's response about stigma, and I think we are all collectively already really working hard to change perceptions around use of AT. Nice example with the two photos on your PowerPoint there of the two children using AT. And I think WHO, you know, we're doing quite a lot within the training package, but also more broadly to really promote positive imagery around the use of devices, but also as we collectively promote assistive technology as being for all people, all types of people, and not a disability issue or specifically for people with disabilities. I think all of those hopefully collectively will help to break down barriers. And as we've seen already, spectacles are fashion items in many parts of the world. So hopefully the change is coming.
Great, thank you. There's another point from Laurie Rosenberg. Can you send the internet site for TAP, please? If we can make that available. Yeah, that should be absolutely fine. I'm having some technical issues in terms of seeing questions, so I'm going to run with a couple of my own, but if there are any others, if some of the co-organizers can send them to me. So sorry if the questions aren't necessarily grouped very well. We're just having some technical issues in terms of accessing some of them. One thing was sort of the last couple of points from my side were to make sure that people are clear on how best to connect into these different activities. Margaret obviously put a link up there regarding how to get involved in the product narrative, but if there are any other means to connect with you or useful approaches or useful mechanisms, please, if you can share that. Regarding just in terms of advocating from the national level to or rather advocating at the national level, what are the views of the speakers in terms of how we can best support the work that they're doing and how we can leverage these different mechanisms for change? And also within that, how will the great report, the global report on access to effective assistive technology, how will it be used in terms of advocacy? To what extent will it be an advocacy tool? Thank you.
Sorry, I missed the first half of your question, Zoe, because I was responding to a message on the chat. But I can respond about the global report if you'd like me to.
Yes. I guess, but it was related to the report and generally just how can the participants, how can all of us within the sector working on assistive technology, how can we support these different initiatives, and how can we all work to maximize them and to leverage them for change at a national level, so that we can tackle the massive unmet need, and to get all of your perspectives on that. Thank you.
Yes, I think AT 2030, AT Scale, WHO's GATE initiative, I would say that those three initiatives are all well aligned, and if as people get involved and keep in touch with those, then they can align with the same messaging, and things like the resolution are really powerful tools to help with that as well. For the global report, I think it absolutely is primarily an advocacy document, and it will also be a benchmark, and it will have strong recommendations. But I think the process, and the report will be published in 2021, but the process itself will really serve to gain momentum for the whole sector, I think, as well as buy-in and the advocacy along the way, with regional consultations planned over the next 2 years. And I think it will also, and is also, we're also seeing that it's going to be an accelerator for the sector. It's already stimulating a flurry of activity, more evidence gathering for more data to go into the report, but as well as identifying gaps for future research. And so I hope that stakeholders will collectively mobilise around it and support WHO to really make it as strong and representative report as possible. And one way to keep in touch with our work is to join the GATE community. If you're not already a member, it's an online discussion forum which currently has 1,400 members from over 100 countries. It's great for interactive discussion, but it's also where we post updates and calls for help and support with the work we're doing.
And I would just add to that that through the work that is happening on the product narratives with AT 2030 and AT scale, that as we begin to publish the first of these, so the wheelchair one should be published in the next couple days, that we will send out those through the GATE network as well. So really using that platform, I think, is a really great way to stay connected and engaged. And as we begin to continue to publish the wheelchair, and then quickly following on that will be the hearing aid product narrative, that we will include opportunities for feedback from the community through forums and other ways to connect directly with the CHI or AT scale or AT 2030 teams.
Great. Kylie, did you have anything final to add? And then I think I'll start to wrap up, so I don't think there are any other questions that have been put forward.
Yeah, thank you, Zoe. I just reflecting on Emma's summary of the AT report and the importance of that. Certainly speaking from the perspective that I have in Australia and with the Pacific region, which often feels somewhat isolated from the rest of the world, the AT report and that really nice open opportunity to consult and be a part of the development of that report is just so important for countries that are that bit further away. And that by having those consultations, that's a really big opportunity to get buy-in from governments from smaller countries. If they can really feel that they've had an opportunity to contribute, they've been a part of the discussion, then that report becomes something that is owned by us all and isn't something that really just arrives from above, but everyone feels that they've had a part in contributing to it. And that means that when it is published, then people feel like that they've got some ownership over how does that get implemented, and how do we make use of this report and this body of knowledge that it is going to bring for us all. So I really just wanted to emphasize that, you know, that participation and that consultation is really, really important and very much welcomed. So that was really the key thing that I wanted to add. Thank you.
Great. Thank you, everybody. Wrapping up, I'd just like to say thank you, everybody who participated on the webinar. I can see there's people from Colombia, from Europe, from UK, and I think also from Asia and Africa. So from what I gather, we're quite a widespread, so people joining at all sorts of times and not great hours. So, you know, it's great to have you all on the webinar. And of course, thank you so much to our fantastic panelists, really interesting presentations, and I hope it was very interesting for everybody online. A short survey will be sent out by Georgina and Holly. Also, thank you to them for supporting me with all the technical work on this. It should only take a couple of minutes. It would be really helpful if you can complete this, because it will also give us a little bit of an indication of who you are and where you're from. And we'll also send out slides and details of how to access the recording of the webinar. Thank you so much, and good morning or good evening wherever you are. Thank you. Bye-bye.